The following educational video was created in collaboration with the Faculty of Biomedical Engineering of the Czech Technical University in Prague and the First Surgical Clinic of the General Faculty Hospital. Blood draw. General principles. Blood is one of the most commonly collected materials with a very wide portfolio of analytes, which we need to establish the correct diagnosis, initiate therapy, and monitor the success of treatment. It can be collected from veins, arteries, or capillaries, either directly from the patient's bloodstream or by collecting from already inserted catheters. A collection system refers to the set of tools used to perform the blood collection. In general, it can be said that the system always consists of a needle for accessing the vein and a collection container into which the blood is drawn. The choice of the type of system used depends on the specific healthcare facility and laboratory equipment. Open blood collection system. When collecting blood, a syringe with a needle is sometimes used, usually with a larger diameter to prevent damage to red blood cells. However, this type of collection increases the risk of injury to the healthcare worker from the sharp object and contamination with biological material. It can also affect the pre-analytical phase of the examination when filling blood into test tubes. For these reasons, the open system has been replaced by a closed system. In current practice, open blood collection is used exceptionally in cases where the use of a closed system is problematic. Closed blood collection system with negative pressure, vacutainer system. The vacuum blood collection set with negative pressure consists of a collection needle, a cap-like introducer, vacuum tubes, and other possible accessories. The double-sided metal puncture needle is stored in a double-sided screw-on sterile cover and is designed to be attached to the cap-like introducer. This type of collection set eliminates the possibility of contact between the healthcare worker and the blood, reducing the risk of injury. The safety needle vacutainer clips has a built-in safety shield that eliminates the risk of needle injury. It is connected to the needle's cuff and can be activated with one hand immediately after the blood collection is completed. The vacutainer flashback needle allows for visual confirmation of successful venipuncture, and its use increases the likelihood of a successful collection. The sterile venous vacuum blood collection set's system consists of a sterile collection needle with a locking mechanism, where the sharp metal part of the needle is inserted into a plastic cone that protects the opposite end of the needle. The cone has locking grooves for securing the protrusions of the blood collection syringe. The collection tubes contain an exact amount of anticoagulants specific to prevent the influence of the examination results and simultaneously prevent clotting of the samples. When inserting the vacuum collection tube into the holder and piercing its stopper, the collection needle may become contaminated with traces of reagent on the inside of the stopper, which can affect some results. Therefore, tubes are collected in an order that minimizes the formation of these errors. First, tubes without additives are filled, if ordered, followed by samples that require special collection purity, such as blood cultures or trace elements. According to the VHAO recommendations, the tubes are collected in the following order: coagulation, serum, plasma, blood count, glucose. We examine analytes from whole blood, non-coagulated blood, blood plasma, and coagulated blood. We examine blood serum. The tubes contain a separation gel. After centrifugation, the gel will move between the blood cells, which will be below the gel, and the blood serum, which will be above the gel.